Cardiopulmonary resuscitation, in short, CPR, is a life-saving technique through which you can save the life of a cardiac arrest patient. Cardiac arrest is a condition in which the heart suddenly stops beating and the person suddenly falls and his breath stops. If a person has cardiac arrest, then if he has a person present, then he can save the life of that patient through CPR. Otherwise, cardiac arrest can die in a few minutes. So let's see how CPR is performed. As soon as you see a person falling, first check their nerves and breath. If the patient's nerves and breath is stopped, then understand that this could be a cardiac arrest situation. In this case, first you have to call the local emergency number and ask for medical help. And then to keep the patient alive until help arrives, to keep the patient alive, you have to give the patient chest compressions. In this way, the patient's chest has to be pressed with force and speed. To do this, you have to put your palm in the center of the patient's chest, and then put the other hand above the first hand and have to press the chest with the same speed at which the heart beats. By doing so, you will actually be doing the heart work of the patient's heart. This means that by pressing the patient's chest, the blood will start to travel in the patient's body. And in this way, the patient's body, especially the brain, will stay alive. You have to give 100 compressions in a minute and keep in mind that you have to give the compression very hard so that the patient's chest goes down to 5 inches. Otherwise, the blood will not reach the brain properly. Along with this, you can give the patient mouth breath, which means after every 30 chest compressions, give the patient a minute or 2 mouth breaths. By doing so, the chances of the patient surviving will increase. Unfortunately, in our case, due to lack of people die while waiting for help due to cardiac arrest. Therefore, if you ever see a case, please do perform CPR and try to save their life. Thank you. Bye.